Welcome everybody to this session of the Nurse Digest webinar series. Today I'm joined by Alicia Graham from the Australian Digital Health Agency and also joined by nurse Tracy Chong. Previously working as a primary healthcare nurse, Tracy participated in APNA's Nurse Transformer digital health project. But since then, Tracy's moved to a role at Coordinaire, South East New South Wales PHN, as a project coordinator for digital health with an aged care focus. So welcome to you both. Today in this Nurse Digest webinar, we're going to hear some nursing related pain points in primary healthcare and how My Health Record technology can alleviate some of those pain points. APNA and the Australian Digital Health Agency would like to acknowledge the traditional custodians of the lands across which we meet and pay respect to elders past, present and emerging, and to any First Nations peoples that are joining us today. Okay, so I'm going to hand over now to Alicia and Tracy.
Thanks, Marg.
Yeah, thank you very much, Marg. I will have my camera off for this first bit just to make sure that we're preserving some bandwidth, to make sure everything is running as smoothly as possible. But I will pop my camera back on when we get to some really important experiences that Tracy's going to share in a moment. Okay, so today we are looking at alleviating pain points in primary healthcare. So as Marg introduced me before, my name is Alicia Graham and I am a digital health educator with the Australian Digital Health Agency. Okay, so an overview of what we're doing today. So I really want to briefly go over some of the My Health Record documents that you guys would probably be familiar with, but I do want to go through them so that you can get the best out of this session. We're also then going to go through some pain points from registered nurse, which is Tracy. And then I will be going through and demonstrating how to find these particular documents in the clinical software. And then we're going to finish up with some questions and answers. Okay, so first I'd like to briefly discuss the different types of My Health Record views that you can see in My Health Record. So there's three different sources of information that can be entered into a My Health Record. The first being a healthcare provider entering data, which are clinical documents. These are our shared health summaries, our event summaries, pathology results, and discharge summaries. Later in the session, I will show you where you can find some of these within best practice. There is also some Medicare sourced information. So this can include Medicare benefits and Department of Veteran Affairs item numbers. It also has our PBS information as well as the AIR information. And last in that section is also our Australian Organ Donor Register as well. So there's a lot of information that we sometimes need to sort through when we're looking at our My Health Record. The last section is the patient entered data that can go in there. So a patient can add personal medication. So for example, if they have a cough or cold and they're getting some cough medicine or cold and flu medication, so it's not a script, but it is over the counter and it's labeled, then they could actually add that information if they wanted as well. There's also allergy summaries and advanced care planning sections. And we also have personal health notes. However, a healthcare provider won't be able to see a personal health notes. This is more for the patient if they're just wanting to keep track of something before their next consult. As we can see in the middle, the infographic is showing some useful overviews that are available on the My Health Record, and I will be discussing a couple of those a little bit later on in the session and how that might just be easier to navigate through these particular views rather than going into all the different documents that My Health Record can show you. Okay, so now I'm going to hand it over to Tracy, who's our nurse champion. She's going to go through some pain points. So basically, Tracy, we're wanting to know what are some pain points that you've come across when working in general practice and aged care. What have you noticed and how have you used My Health Record?
Okay, thanks for that, Alicia. I guess most of my experience has been in general practice, so I did work for a while in aged care. One of the first issues that I encountered when COVID when we were going through the pandemic. So we had received a list from one of the local residential aged care facilities, and it was a list of the people that were due for their first booster. So for their third one. So basically there were some that were listed as incomplete, some were listed as complete, some were listed as not having had a single dose. And I thought, I didn't know how old the list was, who'd compiled it. So I thought, well, I'll just pop into my health record and just check all of these things. So most of them were correct, but there were quite a few that hadn't had any vaccinations at all. Some of them that were listed as having a complete course had only had one or two. So I just found that was a really helpful process to go through. And even though it did take a little bit of time for different facilities, at least then we had the right information. And I guess too that the providers of clinical software must have realised that that was an important issue, because then I guess they changed their software and updated it so that we could actually view that information through the software rather than having to go through to My Health Record, which some facilities find it hard to, or some practices find it hard to access. But still, I always like to use that as a basis of truth for information that we find for people. And a second one that I'm sure that most of the nurses out there can sort of empathise with this, and hopefully it'll solve some teeth grinding. But just trying to access MBS item numbers. And I know for one, when I first started the practice and trying to get my head around care planning and finding out when people were actually due for care plans, and my practice manager would say, "I'll just call Medicare and they'll be able to help you." And so you'd get onto Medicare and you'd be waiting and listening to that joyful music, and you'd be waiting and waiting and waiting. And I thought, this is ridiculous. There has to be a better way. So then finding that information through My Health Record, Alicia's going to take you through that, because it was just so much easier. Even if there was a wealth of that information, you can filter down and actually find out when that person had their care plan done, or when the RACFs, when the 731s were due to be done. So it's just so much easier to do it that way than to actually get on the phone to Medicare. So it saves a lot of frustration. The third pain point was that, I guess, living in the snowy mountains, we have a lot of people who, and I won't call them grey nomads because I'm sort of heading towards that demographic. So I'm not going to call them that. But we had a lot of people who used to travel north for the winter, and they would spend a good 4 to 6 months of the year up, in Queensland, sunny, warm Queensland. And so we just like to make sure that the information that we were compiling and sending up through a shared health summary to My Health Record was actually very accurate and up to date. And because we wanted them to have a safe rest of the year, and then we expected really the same information when they went up north and saw their GP up there. We would also like to get information back. And also, they might have had hospital admissions and discharges. They might have had after hours visits to somewhere. So all of that sort of information was really, really important to share, or then to receive back from when they came back down south when it was too hot up north and they wanted some nice summer weather in the snowy mountains. And the final pain point, we used to share a lot of care from the general practice with the community health nurses. Mostly it was wound care. So we had quite a lot of complex and chronic wounds that we were managing in general practice. And sometimes it was either just too costly or too time consuming. Like I would spend an hour every, twice a week debriding these lower leg ulcers and dressing them. And, we all know that general practice is sort of a bit stressed as far as finances go. So a lot of these dressings that we had to use were quite expensive. So then we'd sort of try and get the local community health nurses involved. So to make sure that the information was passed on correctly, because you might type a letter, you might send it through to the central intake, and fingers crossed it would get to the person that you wanted it to get to in a timely manner. So I used to just adopt the practice and tried to encourage all of our nurses and GPs to do the same thing, that if someone came in for if we were sharing care with the community health nurse and someone came in for their appointment, they were assessed by the GP and myself or some of the other nurses. And if there were any changes in management, we would then upload that information. So we wouldn't just upload a shared health summary, we would also upload an event summary, because that gives you the information that gives you sort of the minutiae, I suppose, of the information that you can see about that patient. So Alicia will go through the differences between a shared health summary and when is best to upload that, and also an event summary and what sort of information you can find in that and when it's a really good idea to upload those. So I guess I know that that's only 4 things, and I know there's a lot of pain points in general practice, but hopefully Alicia will be able to address at least those ones and just show you just what a wealth of information that My Health Record contains, and how we can use it day to day to make our practice better and to help make our patients safer. Thanks,
Absolutely. Thank you so much, Tracy. You've
My
given
pleasure.
us some really great points. And I think everyone online today would definitely be able to resonate with everything that you've said. So hopefully I can show you now where you can find these in a My Health Record, and hopefully you'll be able to use not only just these pain points, but be able to apply these documents to other sort of sticky situations you get into within your general practice. So what I'm going to do is I'm just going to reshare my screen with my on-demand training environment. So just bear with me to make sure I've got the right everything happening. Okay, so hopefully you can see my on-demand training environment. I will zoom in a little bit for you, but I will just stop my video just to ensure that everyone can see it and that there's hopefully no lag for you guys. I'll just quickly do that. And I'm just going to zoom in a little bit so you can see. It's a little bit tiny. All right, that's better. Okay, so in our on-demand training environment here, we do have best practice. Now, I know that a lot of you will be using different clinical software within your medical practices, but I do want to just let you guys know that even though I'm showing you in best practice, it's very relevant to all clinical softwares that are conformant. So you're all going to have a button somewhere within your software that has My Health Record. So we can see on this screen, we've got the My Health Record over here near the Finalize Visit button. It's highlighted in green. This is where we're going to click to find all the patients' already uploaded documents for My Health Record. We also have My Health Record on the top tabs up near our utilities and file and open and all of that. And that's where we would go to if we were wanting to upload a document ourselves. And if we have time today, I will show you briefly where that is in specifically on that button. So once you've clicked on the My Health Record button down near the Finalize Visit, you will come up with this screen here. Now, this is a test patient, so I do need to change my filter to ensure that I'm getting all the details for you. Let me just bring that up. And then I'm just going to untick these 2 boxes because this means it's excluding some of the documents that may be useful for us. So the Medicare documents and prescription and dispense records may be of use to you. This last one here is about excluding superseded or removed documents. I'm going to leave that one on there because I don't want to look at anything that's been removed from my practice. And I'm just going to press update. And sorry if my on-demand training is a little bit slow today. It doesn't like to work on a Thursday, I feel. So once this is renewed, it's going to show us a whole list of different views, the document date, the organization which has uploaded it or it has created it, and the organization type. So if it's a pharmacy, hospital, etc. So the first one I'm going to show you today is the immunization consolidated view. So this one here. Now this really links to Tracy's point around checking for the immunization status of a patient. So getting that list and you don't know if it's in the right date or anything like that. So it's really a really handy document to have. So I'll open that one up. doesn't want to open. Oh, I've upset it. I've clicked too many times. Being impatient. It will come up in a moment. Okay, so this immunization view, once it pops up, it's going to have a wide range of different information that it's pulling together. It's going to have things like the COVID-19 status, if they're up to date or not. It's going to have when their next immunization is due. Here it comes. So as we can see here, we've got information from AIR. We've got the date when it was given, what dose it was, the brand, and what that was for, which can be really handy. It also, if we keep scrolling, has a whole bunch of information from both My Health Record and AIR. So this is going to give you as much information as the My Health Record has. Important to note on this view is our source and author. So it's actually telling you where it's got this information from. So this top section is getting it from AIR. We can see we got it from an event summary that Fred's Practice had uploaded. We've got a shared health summary here. And we can see lots of different ones throughout here. So we can actually see where is this information coming from. So if you look at this and you really want to find more information, if you click on any of these hyperlinks, it will take you to that original source document. So you can have a look at that event summary and see exactly what was going on in that particular area. A patient's record can be empty in here if it hasn't been accessed by a patient or healthcare provider. So you might need to exit out or refresh the record to be able to display that. And again, like I did before, you can change the filters to show when you're actually getting that information from. So it might be up to 2 years, or you might want it even earlier than that. Okay, so that's pretty much a lot of the information here. We do have some observations. Again, there are the same documents that is being pulled in this top area here. So we've got our event summaries and shared health summaries. If there was a discharge summary with that information, that would be on there. It's very rare you see that, but it is possible. And then if you're wanting to go back out, you just press the exit button and it will bring you back to all your different views. So that view is great if you're wanting to find out if they're up to date for a vaccination. Definitely one I would go into to start with, so you're not having to click into the multiple different documents to find all that information. It's got it all there for you. The next one I want to show you is the medicines view. So we can see the medicines view here. I'm just going to open that up and be patient. Oh, much better for me today. Okay, so in our medicines view, we have lots of different information. So we can see that it's got the allergies and adverse reactions. It's also got our medicines preview. Along the other two tiles along the side here are just showing us where some information might have come from. So if there is a recent shared health summary or discharge summary, it will come up here, and you can again click on any of these links to find that, go into that source document and look at that information in more detail. So it's important to know it's extracting all this information from the range of documents in that My Health record, and it will display it in the summarized view. So when we scroll down, so we can see our allergies and adverse reactions. And then the next tile across here, we have our medicines preview. If you click on that, it's just going to help you navigate down the document. So we're still in the same document. So you can see your allergies and adverse reactions. And now we've got our medicines preview. So in here, we can see the source and author. Again, a really important section to look at of who's actually put this information in. The date, we've got the medicine brands and dose and directions. Now, we can either filter this by date, which it's already like that for this one, or we can click on active ingredients. And so it will do alphabetical active ingredients for you. And it has a list of all the different medications recently. And again, if you're wanting the date, you can just click on the date and it will bring it back to where you need to go. So this might be very helpful, like Tracy was saying, if you've got your grey nomads coming through and they've forgotten what medication they take, or the dose or the strength or that sort of thing, you can look at this information to find out what they're on. And I think that can be really handy and time saving for people in general practice. Okay, the next view that I want to show you is our Medicare overview. So Tracy was talking about all looking up our MBS items and having to talk to Medicare, and no one wants to be in the queue for so long doing that. So what I would go into is the Medicare overview. Now, all's going to show you all of them that they have, or you could just go the past 12 months. It's up to you. I'm going to go all just for the purpose of showing you a wide range of information in this test patients file. So first up, we can see our PBS and RPBS information. So again, this would be great if you are wanting to know what medication's been taking recently or been dispensed recently. You can look at the repeats and the quantity and everything like that. You can continue scrolling down, all the way down. We have our information from our organ donor register. We also have our MBS and DVA items. So this is where it's going to tell you the item number that was billed, the provider that billed that one for you. So that's also if they're like, I can't remember the doctor I saw, 2 weeks ago when I was on holidays, you could see it from here as well because it's gathering that information. Again, like Tracy said, if you're wanting to know if a certain item number has been billed recently or if they're eligible to have that billed again, a great spot to come to and see and go, oh, yep, no, they haven't had that billed. We can do that health assessment today, etc. So that's a really great view to just cut out that Medicare on the phone trying to check. And it also will help you if you're dealing with your rejections as well. The last two I want to look at and show you are the shared health summary and the event summary. So I'll just quickly bring a shared health summary up for you. I might need to scroll down. If you are having trouble finding anything in this view, you can go to the documents here and you can find it. So I can do an event summary or a shared health summary. So I'm going to click on shared health summary, update it, and it should just give me anything that's relevant to our shared health summary. So here we go. We've got a shared health summary here. It's the most recent. Going to open that one. So a shared health summary, really, it's capturing an individual's patient's information at one point in time. It is a snapshot. And it will include information about a patient's medical history, any medications they're currently taking, allergies and adverse reactions that they may have, and any immunizations that they may have received. It is prepared and uploaded by the individual's nominated healthcare provider. So these are people maybe like the medical practitioner, a registered nurse, Aboriginal and Torres Strait Islander health practitioners. So they're the people who are seeing this patient regularly, that their regular healthcare provider are uploading a shared health summary. So on here, we can see our medications information. We can see our medical history and some comments that have been mentioned in there. Again, we've got immunization data. And then down here, we've got information. So we do have which doctor uploaded this. So if you're wanting to talk to the doctor who uploaded the shared health summary, you go to the bottom here and it'll have all that doctor's information there. So you could contact them if necessary. So again, it's really important to remember shared health summary is one point in time, and you should be recreating a shared health summary when details change. So for example, you might upload it following the creation of a GP management plan, a 75+ health assessment, if you've administered a vaccination, or even following up hospital discharge and noting any ongoing changes to the treatment. And that's what this is really good for. Now I'm going to show you the other one, which is the event summary, and I will go through how that's a little bit different to our shared health summary. So I'm just going to bring up all update. Doesn't want to update. So basically with our, while I'm waiting for that to come up, our, here it goes. Our event summaries are going to be for healthcare providers that are not their current, not their everyday regular healthcare provider. So it comes up here. So unfortunately, I thought it was in here. Oh, yes. So we've got some event details in here. So shared health summary is just doing it at an event summary is capturing a key health information about a significant healthcare event. And it has to be relevant to the ongoing care of that patient. So it may be useful to indicate a clinical intervention or an improvement in a condition or a treatment that's been started or completed, those sort of things. In an event summary, you do have more things that you can add. Now, unfortunately, this is not showing everything that you have, but I will briefly just mention what information you can add to this. So it's really just given you the clinical notes or information here, which you can add, which I think is really handy for other healthcare providers to look at. You can also add allergies and adverse reaction information, medicines, diagnosis, clinical interventions, immunizations, and also diagnostic investigations. So if there is a certain healthcare event that you have a patient for and you're not their original healthcare provider or your regular healthcare provider, an event summary is something you want to do up so that their regular healthcare provider is updated of this information. So like Tracy was saying with the wound care and everything like that. So on the other side of things, the other medical practice that isn't the regular practice would be doing an event summary in that case, whereas Tracy, as the original or regular healthcare provider, would be doing up the shared health summary because they're the regular provider of care for that patient. And this is just to ensure that communication of care for that patient, that everything is being shared and the information is not being lost or, construed or anything like that. So an event summary, really great for those particular situations. Okay, I have been talking for a really long time and we will get straight into the questions and answers. So I will just quickly pop my screen back up and I will hand over to Tracy to start the questions. Not Tracy, sorry, to Marg for the questions.
Hi, everyone. Actually, there is an early question came through, Alicia.
Oh, awesome.
Can the exclude buttons be set to always exclude?
That's a great question. I believe for certain softwares, now I'm not sure on each one of those, but you can change it in the, what is it called? The utilities part of your clinical software for each provider. So you wouldn't be able to do it broadly for everyone. You'd actually have to go into each of your healthcare providers' profile and change that information. You can also change the date in which it comes up. So if it's always coming up as 12 months and you want more than 12 months worth of records in that same area, you would be able to change that range of information out to like 2 years, for example, or further.
Thank you. And can you attach an ECG to an event summary?
Oh, that is a great question.
We've got some
not sure about that. Look, I'd have to get onto someone and come back to you because that is a great question.
Jot the question down and we'll help Lorraine answer that in time. I've got an option where we can help with that. I'm mindful of the time, so I just want to also ask you about pathology, because if pathology has been requested by another practice, will we have access to the results? So can we speak to pathology and perhaps speak to the new changes that are actually my health record's been upgraded from today? So I'll leave you to respond to that.
Yeah, so pathology results are available to the healthcare provider immediately, as long as the laboratory that the result is going through is registered and connected. We do have some 7-day rules for patients, and that's what you're talking about, Marg, with the changes. So the 7-day rule is for a patient. So usually it takes 7 days for the patient to access their results, and that just gives the healthcare provider a chance to recall the patient and discuss that information if needed. However, there are exceptions. The exceptions previously have been for COVID or any respiratory illnesses. And Now, what's happened is we have our INR and our HbA1c results. As of today, they are uploaded in real time. So that means that patients will be able to access that straight away and be able to see that themselves. So I think that's really fantastic.
That is great. That's great for nurses as well. I'm sure you'll want to know that INR results and HbA1c no longer have that 7-day access restriction. That will be really helpful.
Yeah, absolutely.
Another question, Alicia, is are you able to share the version just that you use then for the demonstration, because it looks different to the version that the participant's asking about?
The on-demand training environment, is that what? Sorry,
Yeah,
you cut out a little bit for me.
That's right. The on-demand training of best practice. Can you share the version that you're using?
Yes. So
is it just available on the website?
Yeah, on our Australian Digital Health Agency website, we do have a section where you can go into the on-demand training environments. We have it for best practice, medical director, communicare, you name it, we pretty much have it. We've got all the main ones at least on there for you. We have PIPS Viewer, we have a whole bunch. We have the National Provider Portal as well. So you can definitely go onto our agency's website and access that on-demand training environment I was just in then.
Fantastic, thank you. And last one, a person that's new to general practice and primary health care. If I used an event summary instead of a shared summary, would it go to the wrong place or record information incorrectly?
No,
information.
So as long as you are authorized by your organization to use My Health Record, then it's going to be going to the patient as we need it. So and I won't go into too much detail because I know we're over a little bit, but there are certain things in place for My Health Record to ensure that the individual, the patient, as well as the organization, they have numbers to ensure that it's being uploaded to the correct places. So that's ensuring the organization, the patient, and the healthcare provider as well. So if you're uploading, it will all go to that patient's particular file as long as you're in the correct patient's file when you click on that My Health Record button.
Thank you very much. And I'm just going to I think we'll just move to the next slide now, where you can learn further information from digital health. You might want to speak to this, Alicia.
Yep. So if you're needing any help or you're struggling with anything, we have our two helplines. So we have the My Health Record as well as the agency helpline. If you don't feel like talking to anyone on the phone, that's fair enough. We do have our website, www.digitalhealth.gov.au, or our email address as well.
And I'd like to thank you, Alicia, and to Tracy for joining this webinar today. Thanks for providing such useful information. I also just want to share with the audience, there was a couple of questions that we didn't get to, but APNA has a robust digital health community of practice where you can ask questions and you can share ideas with peers. So I'm going to put a link to the application to join that into the chat right now as we speak. So feel free to join our community of practice. And if we didn't get to answer your question, please put it up there, and that's a repository where we'll be able to come back to you and respond to your information. So we hope that you utilise that community of practice. It's there for you, and it's got quite a lot of members, a couple of hundred. So you can, hopefully somebody else will help with a response if you're uncertain. So nurses are good at sharing information and knowledge, and I encourage you to join our community of practice. And I'll also let you know we've put an evaluation into the chat box, an evaluation form for today, but the link will also appear in your browser when this webinar ends. So please complete the evaluation form. That helps to guide us to provide information and learnings that you want to know. So we're guided by you with that. All right, so thanks very much once again to Alicia and to Tracy for participating in this Nurse Digest webinar. I hope that you've all gained some further information from it, and we look forward to you joining the next Nurse Digest webinar, which will be held next year, the 2nd of February, 2023. My goodness, I can't believe I just said that. So bye for now. And thanks, Tracy and Alicia.
Thank you. Thanks for
no
having us.
worries.
Okay. Thanks, everyone.
Thank you.
Bye, everyone.
Bye.
Bye.